The U.S. Surgeon General is warning parents about the impacts of social media on their kids, calling the mental health crisis among young people an emergency.
ABC 10's Alicia Machado has more tonight on what he's calling for and what lawmakers hope to do about it.
It's on the side of cigarette boxes and bottles of alcohol, the Surgeon General's warning label. But should it be on social media? Surgeon General Vivek Murthy says it's about time. In a recent New York Times opinion piece released Monday, he called for the warning label on platforms, stating that social media is associated with significant mental health harms for youth.
We see a lot of comparison, and that actually can lead to a lot of depression and feeling bad about yourself.
Marriage and family therapist Kim McLaughlin says it can also lead to thoughts of self-harm. In the article, the Surgeon General states that young people who spend more than 3 hours per day on social media are 2 times more at risk for developing anxiety or depression.
The U.S. Surgeon General has, for at least the second time, made it clear that the research shows that when our kids are on social media for too long, hours and hours a day, it is affecting their health.
State Senator Nancy Skinner sponsored a bill aimed at protecting kids from social media addiction. It's called SB 976 and bars online platforms from sending an addictive social media feed to youth without their parents' consent. Also, limit notifications. The legislature is also considering social media bills creating policies to limit the use of smartphones on school campuses and combat cyberbullying. They're sponsored by State Senator Henry Stern.
Kids are dying, and this is a problem. It's about giving tools to parents and teachers and students themselves to be able to report, to say, hey, when they're getting bullied.
And on Tuesday, Governor Gavin Newsom saying he wants to restrict the use of smartphones during the school day, mentioning the harms to youth mental health. In a statement saying when children and teens are in school, they should be focused on their studies, not their screens. In Sacramento, Alicia Machado, ABC 10.
Alicia, thank you. Please be sure to contact a mental health professional immediately if your children are dealing with depression, suicidal thoughts, or eating disorders.